The total number of cases is 40,869. The total number of deaths currently registered is 506 in the county. Currently, we have 408 patients hospitalized. That represents an increase of over 50 patients since the last time it was updated. You might have received a notification on your phone. That was a statewide program, which is like the Amber Alert program, really just a broadcast to help remind people, perhaps a little bit more abruptly than many had hoped, that we have a very dire situation related to the coronavirus. Really, it was, again, just a prod and a nudge in the right direction to stay home whenever possible, because it's so important for us to not be mixing households during this time. In terms of the ICU capacity, that's a very sad to report that we have really 0% ICU capacity. A very, very impacted situation with our hospitals.
The Porterville Development Center, which is one of the state's alternate care sites, they are scheduling to open that beginning Monday, December 14th. And so they'll be starting staff deployment to that facility. And we're hoping that when it opens for about 20 to 25 patients initially. It has a capacity of 123, but it'll take time to build up.
It seems that the Bay Area and Northern California have more ICU capacity. So while our San Joaquin Valley regional capacity is around 5%, the Bay Area seems to be hovering around 20%. So they do have a little bit more ICU capacity. And I asked that same exact question to Dan Lynch earlier this week, is, when do we start thinking about doing intra-regional transfers? Obviously, that's a huge hardship for families. It's logistically very challenging to try to move a very sick ICU patient either overground, which takes many hours, or in a helicopter, which has its own risks. And so it's not something that we would do without really great consideration about all of the risks and benefits involved. But really all options need to be on the table. I know that those who aren't in the medical field may not understand or quite grasp just how dire this situation is. But all of the things that you're hearing about how impacted our hospitals are, about how dire this situation with our ICUs is, it's absolutely true. And that really is the reason that we want everyone to stay home as much as possible.